Hello, welcome back. The topic today is loss of appetite. I don't know, people anorexia or loss of appetite. So this is a very important question. Most of the people ask us. So morning, I don't feel like eating. So my son doesn't eat morning breakfast at all. He doesn't feel like hungry. So these are the questions most of the patients ask us. So what is loss of appetite? Loss of appetite is you don't feel like eating. It's not a disease. It's a symptom. So what does it mean? So we have to look for what could be the reason. So reason is something. It's only a symptom. So loss of appetite can be divided into two things. One is related to the lifestyle. The other one is disease oriented, we can say, or pathological. So the lifestyle oriented is very simple. Suppose we have a very late meal, like around after 11 o'clock, 12 o'clock, you had a heavy, some plus biryani. Naturally, the next day morning, you won't feel like eating. Or regularly, people are working late night shifts. So they have their food very late. When they have a very late food, naturally, the morning you won't feel like eating at all, or the requirement is not there. Suppose you have a sedentary lifestyle, your job, your work, everything is sedentary, no physical activity, so the body doesn't require any energy at all, so the appetite will be less, or even there won't be any appetite at all. These are the main things. Or lack of sleep. People, if their quantity of sleep is reduced, both quantity and quality is reduced, naturally it will affect your appetite. Or people wake up very late. People, go after their job and late night job, or even naturally people have the habit of getting up very late. People who wants have a job at morning 10 o'clock, so they think, what I'll do if I get up early. So they get up very late. It's at 9 o'clock. Suppose 8 o'clock, 9 o'clock. 8 o'clock is the time where your body, feel like eating. But if you're sleeping that particular time, the appetite will not be there. So wake up early, do some exercise. Definitely, you will have an appetite. The other thing is diseases. The first and foremost is anything to do with the stomach. You have a gastritis, you have an ulcer, you have an acid reflux. So when a food goes in, the body will have a problem. So the body naturally cuts your appetite. So if food goes, some problem will happen. So as a symptom, the body cuts the appetite. Or second and foremost is the other gallbladder diseases, or some acid reflux. All these diseases can suppress your appetite, or even sometimes where malignancies, these can suppress your appetite. The second is very important, medicines. Medicine is very important. Suppose you're taking medicine for a long time, like diabetes, hypertension, thyroid, all these things, over a period of years they can erode or corrode the stomach, leading to gastritis and suppressing the appetite. Uh, or even some diseases like thyroid problem, diabetes, these are medical diseases where they present as loss of appetite. Lack of sleep, another reason. And very importantly, suppose you have physically you have some pain, toothache, or even suppose you have an injury, leg pain, naturally the body will lose its appetite. Or suppose you're recovering from surgery, your body will lose it. Or you're recovering from typhoid or long diseases, the convalescence periods, the lack of appetite or loss of appetite is very common. So the other thing is a psychological and emotional thing. This is very important. Anxiety. Suppose you have exams, you're preparing for the exams, anxiety. So naturally the acid level is too much, or the gut system is disturbed, so you may lose your appetite. Or suppose you have a fear, a panic disorder, or depression, sadness. Suppose you lost somebody in the family, so the sadness, depression, they can lead to a loss of appetite. But loss of appetite could be a normal phenomenon, but if it is a prolonged one, but because of the loss of appetite, you're losing weight. If you lose weight with loss of appetite, it becomes very significant, and you need to see a doctor. The same way, loss of appetite is different. I could not eat is different. If you can't eat because of some other problem, so then again it becomes significant. So these are the things we should, before going to the doctor, you should know, I have only loss of appetite, is a temporary or permanent one, or loss of appetite is combined with the weight loss, or loss of appetite along with I couldn't eat is also very important. So what you can do is you can get up early in the morning, do some exercise, walking, something, and brush your teeth After 2 hours, definitely you will have a natural appetite. So getting up early and doing some physical activity is very, very important. And avoid late night meal. Very, feasts, late night. Avoid that. Have a proper sleep. Go to bed early, get up early. All these things will definitely help you. But if it's prolonged, then you can go to the doctor. They will examine you. The first and foremost, they'll ask for is an endoscopy to see whether you have ulcer, some tumor, or bleeding inside or anything. They will see, look for that. Then probably they may even ask for ultrasound scan or scan to rule out anything to do with the gallbladder, liver, all this, the pancreas. These parts will be ruled out. Then and they may prescribe PPI, proton pump inhibitors like omeprazole, pantoprazole, along with antacids. They can definitely, after 4 to 6 weeks, your appetite will improve naturally. And in spite of all these things, suppose everything is normal, and in spite of all these things, the appetite is very less, and you're losing weight, then probably they may need sometimes counseling, psychological, counseling and all. Otherwise, even doctors can prescribe certain medications. Without doctor's advice, don't take those medications. That's very important. So loss of appetite is only a symptom, it's not a disease. So we have to look for what could be the reason, and whether it's a temporary, nothing to worry, and it's related to the lifestyle, nothing to worry. But loss of appetite with loss of weight is very, very, very significant. And whether it's loss of appetite or I couldn't eat, if you couldn't eat, then it again it becomes very serious. Thank you.